When you look at something complicated like the heart, the physiology involves so many different components. So you have data coming from in vitro environments, in silico data, you have in vivo environments, and when you try to unify these pictures together, you end up chasing down a bunch of different rabbit holes, which lead you to different methods, different mathematical techniques, and you have to utilize all of those to try to integrate them together when you're looking at the heart. And so this has kind of broadly been what's driven us down a number of different paths when we try to think about how we can best integrate all of the data that we can get into personalized modeling. I would say that mathematics has actually already been very useful when you look at the heart. So things like Laplace's law, things like Bernoulli's law have been principles that surgeons and physicians have been using when they try to understand what's happening in a patient's heart already. What's new and what's changing is this idea of personalized medicine, where you start to take more information that you can get from imaging data and embed that into computational frameworks. And this is really a new revolution that I think will have an impact in the next 10 years. It's already starting to have an impact in sort of small scenarios. Yeah, so already personalized models have been started to be applied. So we saw some very nice examples of that at this Congress. There's companies that have already been launched that are in use, so they have approval in FDA and approval from regulatory bodies in the EU. And I think this is going to keep compounding and growing. And there's sort of a hierarchy really of areas where we'll see impact. So little impacts will happen that are more quick to use with data, and then these sort of larger scale vision of how you could integrate everything from modeling into imaging into patient personalized analysis. That's something that's happening on a longer track, but I think we're pretty confident we'll get there. And certainly the offshoots of that, which will happen in time, will produce major impacts and major benefits. So currently, the way that we think about the heart in most contexts is as hyperelastic. That's the way that we simulate the movement of the heart at the moment. And analogous, when you think of a hyperelastic heart, you're basically treating it almost like a bouncy ball. So you would imagine that this heart, if I dropped it, would bounce right back into my hands. We know that this doesn't physically happen. And the reason why it doesn't physically happen is because we have a viscoelastic material. So this material responds and dissipates energy. And this is actually important in terms of how we think about the function of the heart, because if you didn't have that impact, you would end up seeing very non-physical behavior. So physiologically, it would not make sense. The impact of viscoelasticity in terms of how and why tissues have viscoelasticity and have different degrees of it is something I think is a very open-ended question, and I think it's actually fundamentally important to the design of tissues. So muscle tissue has very, very interesting and unique viscoelastic characteristics that are different from other tissues. And I think that's important into the overall design of how the tissue is actually structured. But this is something that requires experiments, computation, simulation to really unearth and uncover why we have that structure.